Good afternoon, everyone. Here is Kadam Pooja Dhananjay. I will discuss about the topic of pharmacology, that is the basic concept in endocrine pharmacology. Then let's see what is the endocrine system. The endocrine system is controlled by two parts of the brain, that is the pituitary gland and the hypothalamus. Pituitary gland is a small pea-sized gland that plays a major role in regulating the vital body function. So that's why it refers to a master gland because of the pituitary glands controls the all endocrine system. The next part is the hypothalamus. Hypothalamus is the portion of the brain that contain a number of small nuclei with a variety of function. One of the most important function of the hypothalamus is to link the nervous system to the endocrine system. So that's why the hypothalamus and the pituitary gland is the most important organ in the endocrine system. Endocrine system is coordinate the various function of our body by transmitting the information in the form of biochemicals between individual cells and the tissue of the body. So this messenger called as hormone. The main function of the endocrine system is to maintain the internal homeostasis, that is the internal equilibrium. Support the second one is the support the cell growth, coordinate the development, coordinate the reproduction, fertility, sexual function, and facilitate the responses to the external stimuli. Then let's see the pituitary gland. The pituitary gland is a small pea-sized gland that plays a major role in regulating the vital body function. Pituitary gland is divided into the two different regions. That is, the first one is the anterior pituitary and the posterior pituitary. Anterior pituitary contain somatotropes, that is the growth hormone. Second one is the thyrotropes, that is the thyroid stimulating hormone. Third one is the gonadotropes. Fourth one is the lactotropes, that is the prolactin, and the fifth one is the corticotropes. And posterior pituitary contain oxytocin and antidiuretic hormone. We will see detail about the anterior pituitary. Anterior pituitary contain somatotropes. Somatotropes are cells in the anterior pituitary. Somatotropes are the cell in the anterior pituitary that produces the growth hormone. Growth hormone is a protein hormone of about 190 amino acid that is the synthesized and secreted by the cell called as somatotropes that is stored in the anterior pituitary. The second one is the thyrotropes. Thyrotropes is a thyroid stimulating hormone, is also known as a thyrotropins. Thyrotropins is secreted from the cell in the anterior pituitary called as thyrotropes. Third one is gonadotropes. Gonadotropes are the basophilic cells of the anterior pituitary gland specialized to secrete gonadotropin in response to the elevation in the intracellular calcium concentration. The fourth one is the lactotropes. Lactotropes is also known as a prolactin cell, epsilon acidophils, lactotropes, and mammotropes. A lactotropic cell is a cell in anterior pituitary which produces the prolactin in responses to the hormonal signal including dopamine, which is inhibitory, and thyrotropin releasing hormone, which is the stimulatory. And the last content of the anterior pituitary is the corticotropes. Corticotropes are basophilic cell in the anterior pituitary that produces proamniocortin, which undergo cleavage to adrenocorticotropin. We see about the somatotropes, thyrotropes, gonadotropes, lactotropes, and corticotropes. All the pituitary glands function depend upon these five content. The next part of the pituitary gland is the posterior pituitary. Posterior pituitary contain oxytocin and the antidiuretic hormone. The first oxytocin is a peptide hormone and neuropeptide normally produced in the hypothalamus and released by the posterior pituitary. Oxytocin plays a major role in social bonding, reproduction, and childbirth and the period of the childbirth. And the second one is the antidiuretic hormone. Antidiuretic hormone is also called as arginine vasopressin. It's a hormone made by the hypothalamus in the brain and stored in the posterior pituitary gland. Antidiuretic hormone constantly regulates the amount of water in your blood. So the diuretic hormone plays a major role in the function of the kidney. So it constantly balances the amount of water in your blood. Then next, We will see about the basic concept of endocrine pharmacology. तर आपण खालीलपैकी कंटेंट बघणार आहोत. ग्रोथ हार्मोन, प्रोलॅक्टिन, सेक्स हार्मोन, ओरल कॉन्ट्रासेप्टिव्ह and corticosteroid. Then firstly we will see about the growth hormone. What is the growth hormone? Growth hormone is a protein hormone of about 190 amino acid that is synthesized and secreted by the cell called as somatotrophs in the anterior pituitary. सोमॅटोट्रॉप नावाचे सेल असतात अँटेरियर पिट्युटरीमध्ये जे सिंथेसिस अँड सिक्रेशन करत असतात. The growth hormone are the water soluble hormone, hence it cannot diffuse through the lipid bilayer of protein membrane. The principle and physiological regulation and mechanism of growth hormone is the secretion are the neural endogenous rhythm, sleep stress, exercise, nutritional and metabolic signals. The growth hormone deficiency results from various hereditary or acquired which causes may be isolated or combined with other pituitary hormone. The physiological effect of the growth hormone. Growth hormone is the most abundant anterior pituitary hormone secreted by the somatotrophs or the anterior pituitary cell. Somatotropin stimulate the tissue to secrete the insulin-like growth factor that produces the hormone which stimulate general body growth and regulate the aspects of metabolism. Due to the alternating splicing of growth hormone gene, anterior pituitary secretes homogeneous mixture of growth hormone peptides that circulate in a blood that is the protein bound to a corresponding the extracellular domain of growth hormone receptor. Here is the pathway of the growth hormone. We will see about the physiological effect of the growth hormone. A critical concept in understanding growth hormone activity is that it has two distinct types of effect. The first one is the direct effect and the second one is the indirect effect. Direct effects are the results of the growth hormone binding its receptor on target cell, the fat cell that is the adipocytes, and the indirect effects are mediated primarily by insulin-like growth factor 1, a hormone that is secreted from the liver and other tissue in responses to the growth hormone. Growth hormone stimulates the longitudinal growth of the bones, increases the bone mineral density after growth ceases and epiphyses have closed. Growth hormone stimulate myoblast differentiation, that is in experimental animal, and increases the muscle mass in human with growth hormone deficiency. And the last one is increases the growth hormone. The third physiological effect is growth hormone stimulate the pre-adipocyte, that is the differentiation into the adipocytes. These are the different types of the physiological effects on the growth hormone. The most important physiological effect of the growth hormone is growth hormone has important effect on protein, lipid and the carbohydrate metabolism. Then we will see about the clinical disorder due to the growth hormone. Growth hormone deficiency in children lead to the short stature, Turner syndrome, Prader-Willi syndrome, chronic renal insufficiency. The first one is the short stature. Short stature is a term applied to a child whose height is 2 standard deviation. Restricted to the growth, does not grow tall as other people of the same gender, age and ethnicity. शॉर्ट स्टेचर ही अशी एक कन्सेप्ट आहे ज्याच्यामध्ये ग्रोथ हार्मोनच्या इन्सफिशियन्सीमध्ये मुलांची हाईट वाढत नाही. त्याच तुलनेमध्ये समान उंचीच्या मुलामध्ये त्यांची हाईट काही प्रमाणामध्ये कमी असते. द सेकंड वन इज द टर्नर सिंड्रोम. Turner syndrome is a chromosomal disorder. A Turner syndrome is a chromosomal disorder in which a female is born with only X chromosome. Turner syndrome results from a missing or incomplete sex chromosome. The third syndrome is Prader-Willi syndrome. A Prader-Willi syndrome is a genetic disorder that causes obesity, intellectual disability, and shortness in height. Prader-Willi syndrome is a genetic disorder usually caused by deletion of a part of chromosome is passed around by father. And the last disorder is a chronic renal insufficiency, long-standing disease of the kidney leading to the renal failure. In the chronic renal insufficiency, the kidney filters waste and excess fluid from the blood. As the kidney fails and waste build up, it causes chronic renal insufficiency. Growth hormone deficiency in adults leads to the decrease in muscle mass, decreases the bone density, impaired psychological function. Increases the mortality rates after the heart surgery or abdominal surgery and the acute respiratory failure. These are the different types of the clinical disorder due to the growth hormone. So the treatment for these disorders are the recombinant growth hormone replacement therapy, that is in the gonotropin, humotropes, norepinephrine, neurotropin or omnitropes. These treatments have some different types of side effect, that is the intracranial with peptidedema, visual changes, headache, nausea, vomiting, leukemia, in adults peripheral edema, carpal tunnel syndrome, arthralgiasis and myalgiasis. We saw about the growth hormone, physiological effect of the growth hormone, clinical disorder due to the insufficiency of the growth hormone, treatment for that disorders and side effect of the treatment. Then the second content is prolactin. Prolactin is a hormone produced by your pituitary gland, which sits at the bottom of the brain. It is structurally related to the growth hormone. Prolactin secreted by the lactotropes of anterior pituitary with other hormone, it initiates the milk production in mammary gland. Prolactin causes breast to grow and develop and causes a milk to made after a baby is born. Normally, both men and women have a small amount of prolactin in their blood. Serum level remains low in normal males throughout life and somewhere in female. Prolactin level rise markedly during the pregnancy, reach maximum at the term and decline thereafter unless the mother breast feed the infant. Only after mammary glands primed by estrogen, progesterone, glucocorticoids, thyroxine and insulin exerts a permissive effect, prolactin brings about a milk secretion. Ejection of a milk from mammary gland depends on oxytocin hormone that is released from posterior pituitary. Some physiological effect due to the prolactin. Prolactin plays an important role in inducing the growth and the differentiation of the ductus and laboalveolar epithelium, which is essential for the lactation. Prolactin contributes to the hundreds of physiological functions, but the two primary responsibilities are the first one is the milk production, and the second one is the development of the mammary gland within the breast tissue. Then let's see the prolactin excess. The first one is the hyperprolactinemia, that is the common endocrine abnormality caused by prolactin secreting the pituitary adenomas. It also results from hypothalamic or pituitary diseases that interfere with delivery of inhibitory dopaminergic signals. Second one is the primary hyperthyroidism, which increases the thyroid level and the renal failure. Third one is the hypersecretion in male, that is the erectile dysfunction, also known as impotency. And the last one is the hypersecretion in female, that is the galactorrhea. In galactorrhea, inappropriate lactation, amenorrhea, that is the absence of menstrual cycle, and infertility. These are 4 different types of the disorder due to the prolactin excess. Then let's see the sex hormone. Sex hormone, also known as a sex steroid. The sex hormone includes androgen, estrogen and progesterone. Estrogen and progestins are the steroid hormone. In a woman, they control the ovulation, cyclical preparation of the reproductive tract for fertilization and implantation and the metabolic action. Estrogen in male have effect on bone, spermatogenesis and behavior. Both estrogen and progesterone are present in both men and women body, but functions are different. Estrogen in male have effects on bone, spermatogenesis, that is the process of formation of sperm, and the behavior. Estrogen and progestin are also used in menopausal hormone therapy and the contraception in women. Estrogen and progestin antagonists are also available. Here is some physiological and pharmacological action of sex hormone. Estrogen in girl cause growth and development of the vagina, uterus and fallopian tube, and it contributes to breast enlargement, molding the body contours, shaping the skeleton and causing the pubertal growth, spout of the long bone and epiphyseal closure. Estrogen plays the most important role in a female body. It causes development of the vagina, uterus, and fallopian tube, and it all contributes to the breast enlargement, molding the body contours, shaping the skeleton, and causing the pubertal growth, sport of the long bones, and epiphyseal closure. The second one is the growth of axillary and pubic hair, pigmentation of the genital region, and the regional pigmentation of the nipples and areola that occurs after the first trimester of pregnancy are also estrogenic action. Due to the estrogen, there is some changes in your body, that is areola that is the pigmentation in the nipple. The another physiological role of estrogen are estrogen plays the developmental role in males. In boys, estrogen deficiency diminishes the pubertal growth, sports, and delays the skeletal maturation and epiphyseal closure so that linear growth continues into the adulthood. Estrogen deficiency in men leads to the elevated gonadotropins, microorchidism, and increases the testosterone level and also may affect the carbohydrate and lipid metabolism and fertility. Adverse effect of sex chromosome. In, uh, it increases the incidences of vaginal and cervical adenocarcinomas was noted in female offspring of mother who had taken the diethylstilbestrol. Estrogen use during the pregnancy also can increases the incidences of non-malignant genital abnormalities in offspring. Estrogen in postmenopausal women increases the risk of endometrial carcinoma by 5 to 15 fold. Old estrogen significantly increases the risk of thromboembolic diseases in healthy women. Nausea and vomiting occur in some women but often disappear with time. Estrogen may cause severe migraine in some women. Estrogen also may reactivate or exacerbate endometriosis. प्रेग्नन्सीमध्ये जे काही इस्ट्रोजन आपण यूज केलेले असते त्यामुळे काही प्रमाणामध्ये जेनेटल ॲबनॉर्मॅलिटी होतात लहान मुलांमध्ये. आणि आपण जे काही ओरली इस्ट्रोजन पिल्स घेत असतो त्यामुळे थ्रोम्बोलिक डिसीज होण्याची शक्यता असते. काही महिलांमध्ये इस्ट्रोजनमुळे उलटी मळमळ होण्याचं प्रमाण आढळून येतं आणि काहींना सिव्हिअर मायग्रेनचा त्रासही होतो. So these are the different types of adverse effect due to the estrogen or that is the steroid hormone. So here is some therapeutic uses for the diseases. The two most frequent use of progestins are for contraception, either alone or with an estrogen, and in a combination with estrogen for hormone therapy or postmenopausal women. Progestin also are used for secondary amenorrhea, abnormal uterine bleeding in patient without underlying a fibroid or cancer, luteal phase, support to treat the infertility and premature labor. Progestins are used diagnostically to test for estrogen secretion and for responsiveness of the endometrium. Progestins are highly efficacious in decreasing the occurrence of endometrial hyperplasia and carcinoma caused by unposed estrogen. The last one is the progestins are also used for metastatic endometrial carcinoma. Megastoral acetate is used as a second line treatment for breast cancer. So these are the different types of therapeutic uses for the excess of these hormone. Then last part is the oral contraceptive. These are the oral contraceptive are also called as birth control pill, are a safe and reliable option for preventing the unwanted pregnancy. These are the hormonal preparation used for reversible suppression of fertility. In the earlier part of the 20th century, methods of contraception used, that is the condoms, diaphragm, spermicidal cream, foams, tablet, etc. These also have a higher failure rate. Oral contraceptive are medicine taken by mouth to help prevent the pregnancy. The most oral contraceptive contain a combination of two types of hormone. The first one is the estrogen and progestin. Both these are naturally found in woman body. Oral contraceptive are medicine that taken by mouth to help prevent the pregnancy. These are also known as birth control pills. So we have seen about the basic concept of endocrine pharmacology. in which the endocrine system, the parts of endocrine system, that is the pituitary gland and the hypothalamus, and the next content is growth hormone, prolactin, sex hormone, and oral contraceptive. I hope this video will be helpful for you. Thank you so much. Please don't subscribe my channel.